Alzheimer's disease currently affects an estimated 5.7 million Americans. By 2050, this number is expected to rise to 14 million, putting immense pressure on resources and government. Danella Sealock was in Washington, D.C. to see how the D.C. Office on Aging has developed a 5-year state plan to maximise resource and make the country's capital dementia-friendly.
You ready? Here we go. Breathing in.
Our mission is to advocate and implement programs for people who are 60 and older, for adults with disabilities, and for their caregivers.
Since 1975, the District of Columbia Office on Aging has worked to address the growing needs of senior residents in our nation's capital. Working hand-in-hand with the community and its network of grantees, DCOA has created a 5-year plan offering programs, support, and resources for both seniors dealing with Alzheimer's and other dementia-related illnesses and caregivers throughout Washington, D.C.
Another thing that we've been really focused on is falls prevention.
Increased funding and support for D.C.'s senior residents couldn't have come at a more critical time. By 2025, an estimated 7.1 million people will have Alzheimer's disease in the United States, with 140,000 seniors residing in the District of Columbia.
The number is staggering, and the impact upon Americans is a demand for an increase in funding and stable funding to support programs.
DCOA offers several Alzheimer's programs, such as Citywide Money Management Program, helping seniors manage their finances, Club Memory, a stigma-free social club for senior residents and their caregivers, and Saturday Respite, offering caregivers in underserved wards 7 and 8 the opportunity to take a break while their loved one is cared for by trained professional caregivers and are mentally stimulated.
For us, what we've really tried to do is support programming where we're seeing you as a person who happens to have Alzheimer's, right? And we're treating you as a whole person.
They would not be able to tell you what they had for lunch today, but they can remember all the words to the music, and they're just having such a great time. So music reaches people with Alzheimer's and other forms of dementia in a place where maybe another program might not reach them.
Having Mom here takes a lot of stress off me, and I don't worry about Mom during the day.
Dr. Swann is very familiar with DCOA's services, first with her mother-in-law, then her husband, and now her 94-year-old mother, Mrs. Vernice, participates in programs at Iona's Wellness and Arts Center, an adult day health program funded by DCOA.
And they all call her Sweetie or Vernice or Hi Vernice, or they laugh and they joke with her, and she enjoys it.
We see that people who are earlier, in the earlier stages of Alzheimer's, connecting with people who are in the later stages. And often what we see happening is that they want to help each other. And so that is really a beautiful thing to see.
What would you say to a DC resident that may be watching this, who is caring for a loved one and feels totally alone?
I think the thing that I would say to them is, you're not alone, that we are here to help support you. So really reach out to us and talk to us about what your story is, and so we know how we can better support you.
Every afternoon she has this big smile on her face that says, I had a great day today, oh I did this, oh I did that. If I didn't have that in the back of my head, then I could not leave her, and I would not leave her.
Every day, the District of Columbia Office on Aging is working on new ways to ensure that Washington, D.C. is a dementia-friendly community and that senior residents are able to live healthy, happy lives with their families, just like Dr. Swann and her mother, Mrs. Vernice.
And did you know you were going to be a movie star today? Oh.